Today I'm going to talk about one of the procedures we do here at Oculus Plastic Surgery. It's called Ptosis Repair. It is spelled Ptosis, and it is the most commonly mispronounced surgery that we do here at the office. The P is silent. So in Ptosis Repair, basically what happens, it's droopiness of the eyelid is what would bring a patient in, and in Ptosis Repair, the muscles that cause that droopiness are actually repaired. So sometimes droopiness can be caused by excess skin, and it's basically just the weight of the skin that's causing, the redundancy of skin on the eyelid and the heaviness and the droopiness to occur. Sometimes, however, it's due to a muscle weakness, and that would be the case with ptosis. So ptosis can be something that a patient is born with. We have very young children that come in to have ptosis repair surgery, and it's something that they just were born with a muscle weakness in their eyelid. It is important to address a ptosis repair surgery in a child because it can actually affect the development of the child's vision and their eye as they grow older. So that's something to keep in mind, and it is something that can occur due to age. As we age, our muscles do become weak, a little bit more lengthened than maybe they were in our youth, and that can cause our eyelids to droop more. Ptosis can also occur in result to a accident. Sometimes patients get in car accidents or might have a little bit of a trauma to their eyelid, and that can actually cause the muscles of the eyelids to react by drooping a little bit. Sometimes it repairs itself as the injury repairs are made by your body, and sometimes it is something that needs to be surgically corrected. So let's see, you can be born with it, it can be caused by an accident, and it can be caused by the aging process. It can happen to one or both eyes, which is kind of interesting. I think some patients kind of think that if it's happening to one eye, then we should go ahead and fix the other eye, but that's not always the case. You can have weakness in one side, and it can just be repaired by itself and made to match the other side. So sometimes it's used to establish symmetry between the two eyes. Ptosis surgery is something that is typically covered by insurance. Although with all of our surgeries that we will submit to insurance, we do go through a prior authorization process just to make sure that it is something that would be covered by your individual plan. It is something that can be covered by a patient's insurance plan, so that's something that's nice to consider as well. If you have a concern about your eyelids drooping, I would come in to see Dr. Cole to talk about it. We can determine if it is ptosis or if it is something that could be corrected by an upper eyelid blepharoplasty, and we would go from there. So just come on in and see Dr. Cole, and we can figure out what's best for you.